Chapter 42, Assisting in Other Medical Specialties. So some of the medical specialties that once you guys go into your internship that you'll be able to have a choice of going into. One of the first ones will be an allergist. So an allergist, they specialize in diagnosing and treating allergies, such as the inappropriate immune responses or allergic reactions to normally they wouldn't produce such an allergic reaction, but now since you have an allergy to it, you're having an abnormal reaction, and it's called allergens. So common allergens that could happen with certain foods, such as eggs and nuts, pollens, medications, insect venom, animal saliva, or animal dander. So some of the allergic reactions can just show themselves locally, such as a skin rash or nasal congestion. Others, though, can be a little more intensive. They can go throughout the entire body. One of the most extreme allergic reactions is called anaphylaxis or anaphylactic shock. That is a life-threatening condition. So you should know emergency medical intervention for anaphylaxis if you're preparing to work in any kind of allergy field. You may need to teach your patients who have those severe allergies on how to use the EpiPen or the epinephrine auto injection. And then a cardiologist. So the cardiologist is a physician who specializes in heart diseases and the disorders of the heart. If you want to be in a cardiology field, to assist him, you must be familiar with the structure of the cardiovascular system and some of the typical exams and measurements associated with it. You also need to know about common heart diseases and their treatments. Many diagnostic tests are performed in this specialty, including electrocardiograms, stress testing, imaging techniques such as x-rays and echocardiograms. Also, to be employed, you may need to assist the physician with some of those tests. Because managing a heart condition involves many lifestyle changes as well. You should be able to educate the patients on proper diet, exercise, the importance of having an emotional support system as well. So dermatology. So a dermatologist is a doctor who specializes in treating the conditions of the skin, such as eczema, acne, and skin cancer. To work in this field, you should have the basic knowledge of the skin disorders, treatments, and the medical term that goes along with the dermatology field. And then you have endocrinology. So an endocrinologist is a doctor who specializes and treats the conditions of the endocrine system, the glands that help regulate all the body systems. To work in this field, you must have knowledge of how the body's endocrine system works, and a basic knowledge of treatment for common endocrine system conditions such as diabetes, thyroid issues, hormonal imbalances, and menopause. Then we have gastroenterology. So those doctors that specialize in that condition or disorder called gastroenterologists. So they diagnose and treat all the disorders of the entire GI tract, from the mouth to the anus, as well as the liver and the pancreas. So proctologists are another type of GI specialist. Unlike the gastroenterologist, proctologists pretty much only treat the disorders of the rectum and the anus. If you work in this field, you must have knowledge of the GI disorders, procedures, and medical term that comes along with that. Then you have neurology. So a neurologist diagnose and treat conditions and disorders of the central nervous system and all the associated symptoms. So nervous system injuries or diseases can result in the loss of sensation, loss of impairment or voluntary muscle, seizures, or mental confusion. Duties include assisting with exams by readying equipment for use, positioning the patient, handling the physicianal tools, and other items. You may be asked to perform certain parts of these exams, so you do have to have a little bit of knowledge on what happens during these exams or procedures. You may also assist with certain diagnostics tests, such as electroencephalography. Responsibilities could be instructing, educating the patients and their families about the procedures, disorders, and the treatments for those procedures. And then cardiology. A cardiologist, I put oncologist, I'm sorry guys. A cardiologist specializes. So then we'll go into cancer treatments. So an oncologist is a doctor who specializes in the detection and treatment of tumors and cancerous growths. The term cancer refers to the number of oncologic diseases that affect different body systems. So all cancers are categorized by the uncontrolled growth and spread of those abnormal cells. So a tumor is a lump of abnormal cells. The tumors then are classified as being benign or malignant. Benign tumors contain abnormal cells, but they do not invade and actively destroy surrounding tissue. However, with malignant tumors, those tumors contain cells that grow uncontrollably, invading and actively destroying the tissues and surrounding areas. Malignant or cancerous growths are capable of metastasizing, which means they're spreading. The spreading of the abnormal cells now is being from the original tumor site into different parts of the body. I did pull a slide off of McGraw-Hill that is very useful for the testing purposes. I'm not going to go over every single one of them, so you guys can just kind of go through and look out the ones. So I did the reproductive. Some of the cancer types would be the breast, endometrial, and cervical. For the males, would be the prostate and testicular. The respiratory system would be the lung, including bronchus. Digestive would be the colorectal, liver, esophageal, oral, mouth, and throat, and then your stomach. Cancers of the circulatory system would be leukemia, non-Hodgkin's lymphoma, and kidneys. Endocrine would be your thyroid or your pancreas. Your urinary would be your kidneys or your renal cells. The nervous system could be malignant tumors of the brain and the brain stem. And then your skeletal system could be osteosarcoma, which also often is in the arms and upper, in the knees and upper arms. And then chondrosarcoma, so that's malignant tumors of the cartilage that's often found in the hips, femurs, and the humerus. Then you have your orthopedics. So that's the medical specialty focusing on the disorders, injuries, diseases of the muscular and skeletal systems. The two systems are very interdependent on each other, so they're kind of referred to as the musculoskeletal system, especially if you are working in the orthopedic field. You'll be asked to assist your physician with the general exams. You may be assisting with x-rays, helping them with casting, applying hot or cold treatments, and then obviously educating patients about their therapy regimens. So then we're going to do the next 4 or 5 slides are the diseases and conditions that you will see in the medical specialties. So in the cardiology field, every year since 1918, the number 1 cause of death in the United States has been the cardiovascular disease or disease of the heart and blood vessels. So unbelievably, about 1 of every 3 American adults has some form of CAD, which is coronary artery disease. So that's when the narrowing of the blood vessels surrounding the heart start to cause a reduction of that blood flow to the heart. So you have to be able to educate those patients on how to properly take care of themselves. Exercising daily, eat healthy, avoid tobacco and smoke. Different risk factors could put patients at risk for heart disease, including inactivity, obesity, high blood pressure, cigarette smoking, high cholesterol, and diabetes. As a medical assistant in the cardiology office, you should be able to teach patients about ways to reduce or prevent heart disease, stroke, and heart attacks. And then some of the cardiovascular diseases. Once again, I'm not going to go through everything on this slide. I'm just going to go through some of the main parts. So you have coronary artery disease. It also could be some of the conditions that happen with that is angina, MIs. If you have dysrhythmias, you can have atrial fibrillation, conduction delays or blocks. That means problems with the electrical transmission within the heart. You can have tachycardia or bradycardia. Heart failure would be your congestive heart failure. Inflammation of the heart tissues. It could be any layer of the heart. So it could be the endocarditis, myocarditis, or the pericarditis. It depends on which layer of the heart is getting affected. Then you can have your valvular diseases, your aortic stenosis, your mitral stenosis, or your mitral valve prolapse. So as we talked about in other chapters, the heart has different valves that help that backflowing back up into the atria. So if these valves start to get injured, they may have to get surgical replacement medications to help reduce the issues that are happening in those valves. And then conditions for the dermatology field, mainly the skin. So you have your acne, your contact dermatitis, eczema, your moles, psoriasis, ringworm, and your warts. I will print out this image because when I went to post it on here, obviously it comes up a little bit blurry. So I will have this printed out for you guys during class. And then you would do your basal cell carcinoma, your squamous cell, and your malignant. So your malignant obviously would be the worst. That is the most dangerous type of skin cancer. That's when those malignant cells start to spread into the bloodstream or the lymphatic system or to the liver, the lungs. Your basal cell is it's the most common malignant type of basal cell carcinoma. They're mainly on the skin, face, and neck. It gives you a higher average for skin cancer if you've had severe sunburns, blistering sunburns in your teens. So it's very important now in your teenage years or early 20s to make sure you're taking care of your skin, because most of the damage is done in your teens or early 20s. And then your squamous cell, it appears on sun-exposed areas, ulcerated or has like a crust. It invades deeper into the skin and has a greater tendency to spread to other body areas. And then endocrine system diseases. So the most common diseases and disorders in the endocrinologist's office are those related to the pancreas, the thyroid, and reproductive organs. So your diabetes, that's when a person's body, mainly the pancreas, does not secrete enough insulin, or the body becomes resistant to it. 3 different ones that we will do is DM1, which is almost like the juvenile, you get it on early onset. DM2 would be late stage, usually caused by diet, genetics. And then gestational diabetes, that is a diabetes that you get while you are pregnant. And then hypothyroidism, that is a decreased activity in the thyroid gland, which means a decreased thyroxine hormone. And then hyperthyroidism, it is an increased activity in the thyroid gland. For example, would be your Graves' disease. And then some men will go about with the gastrointestinal diseases. So you have your anal fissures, which are ulcers in the anal wall, your cholecystitis, which is inflammation of the gallbladder, cholelithiasis, or your gallstones. Then colitis, so that's inflammation of the colon, usually caused by bacteria, food intolerance, anxiety, or some kind of emotional disorder. Constipation, diarrhea, diverticulitis. Gastritis is the inflammation of the stomach lining. Gastroesophageal reflux is another word for heartburn or GERD. Hemorrhoids are enlargement of the rectal or anal veins. And hernia would be when the organ actually pushes through a muscle or wall containing it. Common abdominal hernias include hiatal hernia and inguinal hernia. And then stomatitis or canker sores. So they're the sores on the gums or oral areas caused by herpes or acidic body chemistry. If you're under a lot of emotional distress, sometimes can exacerbate the symptoms of these canker sores. And then common diseases of your neurologic system. You would have your Alzheimer's, which was the debilitating disease that involves dementia and deterioration of the physical functions. Your Bell's palsy, that's when you have sudden weakness or paralysis on one side of the face by damage of the facial nerve. Encephalitis is that inflammation of the brain tissue, usually caused by a viral infection. Epilepsy is when you have, caused by misfiring of the nerves groups in the brain. It's like a repeated having seizures over a prolonged period of time. Your herpes zoster is the virus that's caused by chickenpox. Meningitis is when you have the inflammation of the meninges that surround the brain. Your migraines, then you have your multiple sclerosis. That's when your central nervous system starts to degenerate. Neuritis is any kind of inflammation of one of the nerves, like your sciatica. Then your Parkinson's disease, that's your progressive neurological disease. And then nervous system conditions, there are a few more that we need to discuss just for a little bit. You have different parts of your body that become paralyzed. So you have your hemiplegia, that is paralysis on one side of the body, commonly caused by a stroke, brain, or a spinal cord injury. Paraplegia is paralysis in the lower extremity. So if you see the middle image, that's your paraplegia. And then quadriplegia is paralysis of your arms, legs, and all muscles below the neck or spinal, below the neck area. And then you have your encephalopathy. So that is a term for a disease of the brain that alters brain function. That could also be from an infectious agent, metabolic dysfunction, a brain tumor, increased pressure on the skull. Most prevalent sign of this would be altered mental state. Common symptoms of encephalopathy would be progressive loss of memory, cognitive ability decrease, slight personality changes, your inability to concentrate, lethargy, and progressive loss of consciousness. And then conditions or diseases of your musculoskeletal system. Conditions and diseases of your musculoskeletal system. You have your arthritis, which is inflammation of the joints. Your bursitis is the inflammation of those sacs surrounding the joints, or your bursa. Your carpal tunnel syndrome, that is when you're having wrist pain and numbness by compression of that medial nerve in your wrist. Dislocation is any kind of displacement of the bones at the joint so that the parts are supposed to make contact no longer come together. Most common in fingers, shoulders, knees, and hips. Then you have your herniated disc. So it's protruding contents of that disc compress your nerve roots, causing severe pain. Osteomyelitis, that's an infection of the bone. Osteoporosis would be decreased bone mass. Paget's disease, that is a chronic condition that causes bone deformities. Scoliosis is abnormal curvature of the spine. A sprain is any injury to a ligament caused by joint overextension. And then tendinitis is inflammation of any one of the tendons. And then exams and testing in medical specialties. So some things you could do in an allergy field. You have your scratch tests, suspected allergens are applied to the patient's skin, usually on the back or the arm. So they do like a line or prick test. So the allergen is applied superficially to the skin. You'll see it kind of on here. Then you have your patch test, which is placing a linen or paper patch on the uninvolved skin and then using a dropper to soak the patch with that suspected allergen. And then an intradermal test would be the injection of a small amount of the allergen into the intradermal layer of the skin. Exams and testing in medical specialties with the cardiology field. You would be able to learn how to educate or use an EKG machine or an electrocardiogram. So what an EKG does, it measures the heart's electrical activity by placing electrodes on particular areas of the chest and limbs. Your Holter monitor is a portable EKG system that the patient takes home, and then they can wear it over a specific amount of time, bring the Holter monitor back in after that specific amount of time, take out the SIM card that's in there, put it into a computer screen, and it will be able to read. It's like a constant EKG that's running forever how long the doctor wanted the Holter monitor to be read. They'll be able to kind of read it forever long, the information's on that SIM chart, or the SIM chart on the SIM card. Then your stress test. So that is recording an EKG while the patient is exercising. So what it's doing, it's measuring the patient's response to any kind of increased workload. And then radiology and imaging techniques. You'll learn or have knowledge of how to use chest x-rays, your MRIs, your echocardiograms, cardiac catheterizations or angioplasties, which is our image on here. An angioplasty is they kind of go through the artery. They place this long kind of stent through here. Then they inflate the balloon to kind of help open up the vessel. And then once they're done, this little metal piece comes sticking out. And then that balloon at the end is it's called a stent. It stays in place here, and then it allows for increased blood flow. So these are very good, like in the cardiac, you can put them in legs and arms, but it's more common for them to put into the heart to help increase the blood flow to the heart. And then your dermatology exams. So there are, during a whole body skin exam, the dermatologist examines the visible top layer of the entire surface of the skin, including the scalp, genital, and the areas between the toes. They use a magnifying lens and a bright light to look for lesions, especially any kind of suspected moles or precancerous growth. And they use a procedure called the Wood's light examination. So I did kind of find a picture of it. It's like an ultraviolet blue light, and you put it on in a darkened room, and anything that comes up abnormal will kind of be highlighted a little bit. So you see, like down here would be dry skin. If you have sun damage, it kind of comes up a different color, dead skin, and then oily skin. So if it was all completely blue, that means you would have no damage at all. But you see the highlighted colors on here kind of do indicate something that's abnormal a little bit. Then your endocrine tests and exams. So the practitioner will assess the patient's skin, the weight, and cardiac function for clues about the illness. In a thyroid scan, the patient receives an oral or intravenous drugs of a radioactive iodine. And then the thyroid is x-rayed as the material is absorbed. Ultrasounds can also be employed to view the glands or detect tumors. And they also can take urine or blood samples, maybe tested for the presence of glucose or hormones. So I did find a picture of the little thyroid x-ray here. And then your gastrointestinal exams. You have your endoscopies. That is a general term for any procedure in which a scope is used to visually inspect any canal or cavity within the body. Most endoscopic exams are performed with like a flexible fiber optic tube that has a lighted instrument on the end. So if it's going by way of mouth, it's called a perioral. That is used to view the esophagus and the stomach. Colonoscopy would be by way of rectum to view the large intestines. Proctoscopy by way of mouth is to view the rectum and anal canal. And then sigmoidoscopy, again, is by way of rectum, and that's used to view the sigmoid section of the large intestine. Then you have your gallbladder functioning test. So the patient will swallow tablets of this contrast agent the night before the test. The x-ray is taken 12 to 14 hours later. That should show that contrast agent in the gallbladder. The patient then swallows a substance that's high in fat, which would make the gallbladder contract and empty that contrast agent now into the duodenum, or the top section of the intestine. And then you have your barium swallows and barium enemas. So barium swallows are your upper GI. They're detecting abnormalities in the esophagus, stomach, and small intestines. And then your barium enema is called a lower GI. That detects the abnormalities in the large intestines. So what is a barium swallow? So barium swallows are exams that are used to determine why a person is having difficulty or pain while swallowing. Weight loss, vomiting with blood, and other abdominal issues would be a reason why a physician would prescribe a patient a barium swallow. Its barium sulfate is a metallic and can show up on x-rays. So doctors use it to see if there are any blockages or any other issues in the throat along the esophagus tract as well. Neurologic testing and exams. They'll test cognitive function, your electroencephalography, which records the electrical activity of the brain, a full brain scan, a CT, MRIs, your PET scans, and then your myelographies, which is a visual x-ray of the spinal cord after an injection of a radioactive contrast medium into the air space of the spinal subarachnoid space. So I did find an image here of that. So they're injecting the spinal cords right here. The needle's going in and they're injecting that contrast dye into the space right in there. And then oncology exams and testing. So your cancer treatments. You can perform surgery, which is surgical removal of the tumor and some of the surrounding tissue. It's most effective when the tumor appears to be contained within a specific organ or it's localized in an area of the skin. Surgery is often followed, however, but radiation therapy or chemo usually does go along with that surgery. Radiation therapy is they're using radiation to kill and stop the growth of those tumor cells. It's often used in conjunction again with surgery and chemo. And then chemotherapy is the use of a strong anti-cancer drugs to kill the malignant cells. This is the drugs that make the people really sick, not the radiation. So chemo can be any variety of chemotherapy. Drugs are available. It just depends on which kind of cancer and how your body works onto which kind of chemotherapy drug the oncologist will prescribe for you. And then in orthopedic, you have your orthopedic exams and testing. So an orthopedic will use inspection, palpation, the diagnostic test to assess the structure and function of the musculoskeletal system. So some of the common things, common exams they will do. You have your x-rays, your CTs, your MRIs, your angiographies, which could check for the vascular structures. Your myelographies are checking for spinal disorders. Your discographies or any kind of the invertebrate disc disorders in your spine. Arthrography would be for your joint disorders, and then your bone scans would be looking at the bones. Your arthroscopy, that enables the orthopedist to kind of see inside of a joint, usually the knee, shoulder, or hip. So they'll use like an arthroscope. And there is a picture of it here. So it's a tubular instrument, includes an optical system. So that's when the tube is inserted into the joint, and then the joint can become visualized. So the arthroscopy is used to give the physician a closer look at the conditions, such as the injuries and degenerative joint diseases, and to guide those surgical procedures. And then your joint replacement, often used to treat knee and hip joints severely damaged by arthritis, disease, or injuries. And that is chapter 41. Please take the time to go back and review the previous slides that had all those information on with the different conditions. All right, I just want to thank you guys and hope you guys have a great day.